Hi, Sinthuja. How are you doing today?
Hey Miranda, I'm doing great. Thanks for seeing me today.
Yeah, I'm really glad that you're here. I appreciate you taking the time to be here with me. I know supervision can feel really intimidating at first, so I hope you're proud of yourself for taking the steps to be here.
No, thanks for saying that. It's really a journey. I know I just started being a
Mm-hmm.
supervisor, so coming out of grad school and starting, it's a big difference between learning and kind of implementing, but I put it through, and I was hoping you can give me some insight into how my session went with Ramon.
Yeah, I appreciate you sharing that with me. I know, like I said, it can feel very overwhelming at first, but I'm here to support you through this process. And thank you also for sharing the video with me. Today, we will be focusing on conceptualizing your client, Ramon. I'll be exploring your techniques. We'll be identifying some areas for development. And I want to let you know that this is a space to reflect, gain insights, and really focus on refining your approach. Supervision is all about growth, all about support. So please, at any time, too, if you need to take a moment, or you need to take a break, or if you're feeling anything at all, just let me know and we'll pause, okay?
Awesome. Thank you. I appreciate that.
Yeah. So as we know, we're going to explore Ramon a little bit more in depth. I want to make sure that you feel very clear on how to conceptualize him, use your interventions effectively, and feel more confident in your role as a counselor. So before we begin, could you tell me briefly how did this session with Ramon feel with you for you?
Yeah, so personally, I was a little bit nervous because he was
Yeah.
a little bit hesitant, wants to pursue school,
Mm.
but
Mm-hmm.
um, you know,
Mm-hmm.
not really. He's obviously fearful, like he has some negative formed beliefs about
Mm.
himself. Did kind of work through that through the Adlerian approach, using
Mm.
those five skills. I did try to help him to navigate
Mm-hmm. Mm-hmm.
through where it was coming from, also kind of identifying
Mm-hmm.
through responses and to
Mm-hmm.
give him a little bit more confidence in himself and to shift a
Mm.
lot of those narratives. So I did go through those five skills of
Mhm.
encouragement,
Mm,
early
mhm,
reflection, spitting in the soup,
mm,
the
mm,
push button technique, and acting as if. So
mm,
I did
mhm.
approach it with all five skills.
Wow. So it really sounds like you're doing amazing work with him already. And I really wanted to focus on highlighting how attentive you are to him. I can see that you're really present, you're really engaged, and you've implemented some really transformative techniques. So I think there's a lot of growth that's already happening there. And I hope that you can acknowledge that for yourself. One thing I wanted to say before we dive deeper into conceptualizing, Ramon, is that what you're feeling is completely natural at this stage. You're newer to the field, you're just starting to feel things out and get a feel for what feels right for you, what might not feel so right. So I think as you continue to navigate that, you'll be able to trust yourself a little bit more. What I follow in supervision is the integrative developmental model. So, as I mentioned, feeling nervous and overwhelmed and a little bit unsure is completely normal. You're in level one development as a counselor, so you're novice. But what that means is you maybe focus a bit more on feeling very unsure, uncertain. And so I think what really helps at this stage is helping you focus on structure, really focusing on specific interventions together and really go over any concern that you might have about making any mistakes. I know when I was just starting out, I was very, very overwhelmed, always had a lot of self-doubt. And I think this is something that definitely comes with time. And I hope throughout this process, we can really just look at your strengths and look at the areas from an objective standpoint for improvement.
That's amazing. No, Miranda, thank you for saying that. It kind of does
Mm,
normalize a little bit of my struggles. Sometimes
mm,
that, obviously, from someone in the field too, kind of really helps to kind of
mhm,
hone in on
mm,
those strengths because that imposter syndrome can really
mhm.
come through in the beginning. So
Mm,
it's important. And I do appreciate you sharing the technique or approach you're going to be using.
hmm hmm
And I would love to hear a little bit more as we go.
Yeah, well, my goal is to really help you move forward and really want you to gain that confidence in yourself. And hopefully, as we navigate the conceptualization and technique, we can do that together. So let's jump into Ramon for a little bit of time. If that's okay with you?
Yeah, of course. I'd love that.
Okay, so I just wanted to make a few notes that I saw from the video. So Ramon is presenting with some self-doubt, huh? A lot of perfectionism, fear of failure. So one thing I really want you to think about when you're properly conceptualizing him is in this case, what I would how I would approach it would be from a integrative perspective. So I think the reasoning for that in this case would be it doesn't limit us so much in what we can do or what we cannot do with Ramon. And it helps us really gain a bigger picture or gives us bigger ideas, a bigger clarity of what Ramon is experiencing. So to start, one thing I want to focus on is maybe from an Adlerian lens. We can see that Ramon's core issue is rooted in the early experiences of exclusion and criticism, which we can see shape his sense of inferiority. So a lot of the bullying that he experienced, I noticed, made him really feel not good enough or like there was something wrong with him. So I can see that he carries a lot of shame, doesn't he?
Absolutely. I think that was a big one, kind of tapping into his
Yeah.
so through that strategy of early recollections, just kind of going into a moment where he did not feel good about himself, um,
Yeah, yeah,
and where it started to form. And so him getting bullied was a big one. So kind of being bullied
yeah.
in during his physical education class, I think it was when he mentioned
Mm,
by the other boys, and then he did get into a physical altercation
mm,
with them. But we shifted. It's how so the concept of what I
mm,
brought in that is
mm,
how he perceives it and reacts,
mm, mm,
right?
mm,
So I think when he mentioned, oh, it's because something's wrong with me, so they attacked
yeah.
is
Mm,
something's wrong with me is how it creates a negative association to that. And then we
mm,
shifted it to more, no, it's not, something's not wrong with you. It's how
mm,
others have,
mm,
behaved. So it's not you the being the problem. So he got to really
oh,
positive recognition of that. So I think that was a great moment. That was kind of a great breakthrough, I felt. But just kind of wondering where do I kind of move from there? Is this sufficient or not? But I like how the
mm,
integrated approach you're bringing in might be a
mm.
little bit positive.
Yeah, and one thing I want to say is there's two things. So the first thing is I'm really glad to hear that you're able to acknowledge the work that you're doing because what I hear what in that happened in that moment was a really powerful shift. You were really able to help Ramon identify an early experience that was causing him a lot of limiting beliefs, a lot of pain too, a lot of that shame, a lot of those feelings around not being maybe worthy or valuable. And it sounds like you were really able to stand beside him and support him, not only through those painful experiences that he was having, but also you were able to help him really shift, right? Reframe that perspective and help him see that it was not a representation of him, that there was nothing wrong with him, that in fact that behavior was their problem, that they were responsible for that. So I can really see how you were able to help support that client. And in the video, I can see how he had just like a light bulb switch even. So I think that's something to really hone in on. And I hear the concern where you're saying, where do I kind of go from here? What do we do now or next? I just wanted to make sure that we didn't dismiss such a powerful moment. Yeah, I hope you're proud of yourself for that.
Thank you. That's appreciative. And it again, it helps me to also recognize some of the
Yeah.
positive of the relationships. So that also shows like how
Mm.
strong of a life you hold with
Hmm.
one another. I think that is a very
Hmm.
important piece, because he wouldn't have come maybe able to through. very quickly this way. So that alliance is definitely a big one too, a big factor.
Yeah, I really noticed that in the video as well. Ramon, he seems to be in such a safe space with you. He feels very trusting. He opens up to you. And in the beginning, one thing I also observed was that he was very nervous. He had never been to therapy before. And so you were able to really ease his anxieties and his worries. And I think that, that comes very naturally to you. And so even though, right, we reflected on the stages of development so far, I think there's so much that's already there. So I hope you can really trust that to guide you. It seems like there's that ability to really naturally make him feel comfortable. And I think that's something that we can't always learn that. I think that comes very naturally for some people. So that's really big as well.
No, thank you so much. And I know it's like I'm glad to hear that because my perception of the session, it felt
Mm,
as if like maybe I
mm-hmm,
wasn't doing enough, or maybe it
mm,
felt, kind of uncertain. Like I did feel
mm-hmm,
quite nervous with this client, so I wasn't too sure how
mm-hmm,
was I going to help him to break through. But that moment I did feel like it was
mm,
kind of
mm,
transitioning into those different stages, especially like helping him to view
mm,
himself as if he did,
mm,
he was successful and he got to where he was, and whatever
mm-hmm.
the case is, like made him also recognize some of that. So absolutely
Yeah.
seeing a different side to that. I think especially when you observed
Mm-hmm, mm-hmm,
my videos, Miranda,
mm-hmm,
were you able to see or recognize in anything there that
mm-hmm.
you may think I should be working more on?
Yeah. I guess one thing I want to maybe focus a little bit on is what you just said about your own self-doubt. As we said, it's very normal and natural to have as a counselor, but I think that goes in alignment with a lot of the feelings that Ramon might be experiencing as well. So Ramon, he has like the good grades, he's high achieving, he's doing well. So there's all these lists of all these positives. Yet he still has that self-doubt that he won't get into grad school. And I know you're feeling like, oh, I'm not doing enough, but I see so far that everything that we're talking about is you're going above and beyond and you're doing so much. So kind of like Ramon, it sounds like you're having a hard time acknowledging all that work that you're doing. And I'm wondering what you feel about that piece there.
That's a good point you're making. I think this is I could see how like I'm kind of
Hmm.
focused on that self-doubt and
Hmm.
and like could I be doing more? But
Hmm.
recognizing that I have put a lot of that effort in,
Hmm.
I
Hmm.
do like now kind of reflecting back a lot of the breakthroughs that I've kind of made with him. So
Hmm.
that
Hmm.
also indicates that strong relationship I hold.
Hmm.
Um, and for him to be vulnerable with me and open up about his past. So I definitely see where you're coming from. I know I could see I am
Hmm.
now that
Hmm.
you're putting it,
Hmm. Hmm.
I'm going back to that, right? Self-doubt.
Yeah, and I guess, that leads me to the next factor that we can consider in this is some of the things you've already named. So we can see that Ramon has that self-doubt, but it's also rooted in some core beliefs. So this is where maybe I would take more of a cognitive behavioral therapy standpoint. So it sounds like he is dealing with some maladaptive core beliefs, such as I'm not good enough, ones that you've already challenged with him. So just to really point that out. And I think this can be reinforced at times with all or nothing thinking, which is also known as cognitive distortion. So maybe helping Ramon also continue to recognize that each time that he's having a cognitive distortion. And as you've been doing, replace it with a more helpful or more supportive belief, it might be helpful to what he's experiencing. And I think the same can be maybe applied to even you and your own journey as a supervisor or as a counselor as well. What do you think about that?
That's a great point. Like I've been very stuck with
Yeah,
maybe using this one approach. I think maybe it is kind of cycling
yeah,
a little bit. Maybe
yeah.
that's another reason I could be feeling stuck at the end of it, maybe
Mm-hmm,
staying a little bit from that and
mm-hmm,
trying to bring in another potential technique or approach is an
mm-hmm,
interesting point. I
mm-hmm,
haven't been able, like I've been
mm-hmm.
fixed on this one approach. But I could see like how, shifting into more challenging his negative
Mm-hmm.
core beliefs could be quite helpful to reframe
Mm-hmm.
his thinking and then obviously help with his actionary
Yeah.
response. I haven't thought of that, so that's quite interesting. How would I be able
Mm-hmm.
to kind of transition from this? Like, is this
Mm-hmm. Mm-hmm.
guide me a little bit to how I would shift? Like, is this? I don't believe maybe it's
Mm-hmm.
a way to just impose like let's
Mm-hmm.
do this, but kind of
Mm-hmm.
um like I'm just trying to weigh in like how do you think would be a great strategy?
So I just want to clarify what you're asking. So what I hear you saying is how would I maybe implement this exercise with Ramon?
Yeah, like should I be
Yeah.
like addressing this with him first, talk
Mm-hmm.
in the approach that we'll be taking, and then
Mm-hmm.
guide him through, give him some sort of psychoeducation on
Mm-hmm.
why we're transitioning into that if we are still kind of stuck in this
Mm-hmm.
negative core belief that he's not transitioning out of. Like he's still kind of like,
Yeah.
in those sessions where he's bursting and saying, yeah, I acknowledge this, I see this.
Yeah. Yeah.
Try the tapping technique
Mm.
too,
Mm-hmm.
where you tap on the thighs, kind of associate
Mm-hmm.
positive qualities or traits of ourselves and positive labeling. So that's something we just started and hopefully it
Mm-hmm.
comes through. And should I wait a couple of sessions to
Mm-hmm.
see how that
Mm-hmm.
goes? Yeah.
I hear what you're saying now. I hear that there's you're really picking up on Ramon's feeling stuck around his core beliefs. So I know you've had the one session, I believe, so far. So I would say I think in the beginning of counseling, we're really getting to know the client, we're really getting to know what works for them. I like to let the clients know from the beginning that I do take an integrative approach. And so what that means as I get to know them, I'll be continuing to assess what their needs are, listening to them, of course, and really noticing when we do get maybe stuck in a certain place. So what you mentioned, which is really important, is yes, if you are going to be transitioning to a certain technique or you're going to be utilizing a certain technique, I would recommend providing always psychoeducation and providing any observations that you've made as well back to the client. So as you mentioned, this might be after a few sessions where you continue to just kind of feel things out and see what he might need, what might be best supportive. And you could explain to him what the CBT approach is, go over what you noticed around his core beliefs and how some of them are also known as maladaptive beliefs. And those are the ones that are limiting him. And then you can say, we're going to go through an activity together to try to think about more helpful or supportive beliefs together. Or you could list some of the facts that are going to counteract that belief, essentially. So I am always failing looking at the evidence, what evidence supports this. And in Ramon's case, it sounds like he's doing quite well and he's been very successful. So we could see that that would be a belief that would be challenged. Um, Providing this psychoeducation does help support the client in an understanding of what you're doing, how you're guiding them, and also if they feel comfortable with that. Like I said, that's why I like to really kind of take things as they come. And I think as you continue to work with the client and really trust yourself, you'll know what feels right and things will naturally flow for you. And I can already hear that there's already a strong sense of what's working and you're asking the really important questions. I think when we're stuck, we want to get unstuck really quickly. But that's one thing to be noted is that you're there and you're supporting the client. And I think just over time that will also become a lot more smooth.
That's amazing. No, that's a good point, Miranda. I appreciate that. I think the concept of, feeling like things have to, the ball needs to keep rolling, like,
Yeah,
transition so quickly or, you know,
yeah.
results to be quick. Is
Hmm,
kind of like a
absolutely.
go-to in the beginning, kind of it's almost like a
Yeah.
fixation on the approach.
Hmm. Hmm.
But now that I've been with this client for a couple of sessions because we have a good
Hmm.
rapport
Hmm.
with people to, be vulnerable.
Hmm.
I believe that's why, like, I feel like we're feeling a little in this
Hmm.
out, but
Yeah.
it's very con like as you started to see in the observe in the video too later, he
Mm-hmm. Mm-hmm.
started to get very confident, like when he's
Mm.
himself, because there is
Yeah.
an interest in
Mm-hmm.
applying, and he's good like when you're kind of breaking
Mm-hmm.
it through,
Mm-hmm.
you can see
Mm-hmm.
he's comfortable
Mm-hmm.
when
Mm-hmm.
you ask, but he does
Yeah.
strongly with, let's say, telling, okay, you know what, I am good enough and
Yes.
smart. I have a strong
Yeah.
GPA. Like,
Yes.
he does work with the HIV, so in a clinic,
Mm-hmm.
he's been very experienced. He has the experience.
Mm-hmm.
He has been
Mm-hmm.
doing a lot to give to the community. I think he even said it like, I feel proud that I
Mm-hmm.
community and things. So there's some
Mm-hmm.
positive, which is good. Like it shows that he's able to pick up
Mm-hmm.
those aspects of himself.
Yeah.
Help with creating Cheech. Now it's kind of creating a consistency, somewhere to continue to hold
Mm-hmm.
um a little bit. So I think navigating into a potentially different approach if there is stuckness is a really great idea. Absolutely.
Yeah, I really appreciate you sharing that back with me. And the one thing to consider to add on to that is his not just his ambivalence about school, but it is his self-identity as a whole. And so there are many layers to consider. There's the cultural aspect to consider. I know we focused a lot on the upbringing, but that is something to also see if that's something that influenced him. I also wanted to mention too, if we only focus on his decision making, we might miss the deeper rooted work that needs to happen. So I just want to make a note of that. And I guess as we're kind of focusing a bit more, just gonna go a bit more to observations from the session now. Before we do that, just wanted to check in with you and see, do you feel everything that we've discussed so far aligns with how you saw him in session? Are there any concerns before I give you a bit of observational feedback?
No, I think I've brought through what I felt. I don't know how it was exhibited in the video,
Mm-hmm.
but
Mm-hmm. Mm.
but I was quite nervous a little bit and feeling
Yeah.
motivated, but I did get through a lot of positives in terms of those skills to
Yeah.
help him.
Well, before we go into this, I just want to say your empathy, your care, your presence, there's so much that you're giving, Ramon. The ability to feel safe, to open up. And so I think you're doing really great work with him. And I observed so much of that in the video. And that's something that helps me um maybe guide into this next part. So I wanted to say your use of encouragement in the video towards Ramon was huge. It was very strong. It was effective. I noticed that you validated Ramon multiple times. And as you were mentioning, he really responded well to that. That was excellent. I think encouragement is foundational and very effective in building therapeutic rapport. And that's really sometimes tough to do because it can feel very unnatural. But in the video, it really looks like it comes to you very naturally and intuitively. So the one concern that I am thinking about is the challenge. So handling the resistance, the stuckness that you've brought up. So there was a moment I noticed in the video when Ramon hesitated and expressed that self-doubt about applying to grad school, about applying to grad school. And so I noticed that instead of kind of pausing and sitting with him in that discomfort, you quickly wanted to reassure him and you quickly wanted to fix things, wanted to resolve it. And so I think this is something that is newer for counselors. We want to, like, of course, we want to get into those core beliefs, unpack all those things right away. We want to go into that fix it mode, right? I know myself personally, I believed it was my job to fix every client's problem that they came in with. I just want to let you know that that's going to be a road to burnout. So we want to be mindful of. You're not there to fix their problems. You're there to support them in their journey and walk alongside them. And so this is something that it's very natural and it comes from a place of empathy and you want the client to feel better. But sometimes the client needs space to experience their discomfort so they can process it. And often, not always, but that stuckness you could be feeling could also just be that discomfort that the client's experiencing and just really needing that to time and space to be dedicated to allowing them to experience that sadness, that shame, that guilt, whatever it is that they're going through. We don't always have to reassure right away, but I know myself too. I did that a lot too. So again, very normal to experience and to want to. What I suggest is instead of immediately reassuring him, try reflecting back his hesitations, or so try saying, I hear that you're doubting yourself. What are you feeling when you hear those thoughts in your mind? What do you think is causing this pain? Which you've already done some of that work around, but really inviting him to explore, I think, the feeling so he can engage with his fear and doesn't feel like he has to avoid it. Does this make sense?
Yeah, absolutely. That's very interesting. And it's a great point you brought through. I think that quick need to kind of get the ball rolling again, like kind
Yeah,
of
yeah.
is something that I can reflect on now. Like I get
Mm-hmm, mm-hmm,
from I think a
mm-hmm,
tool that I have never, I haven't
mm-hmm.
practiced yet is that silence.
Yeah,
I think
yeah.
is a really good one. I know not needing to
Mm-hmm,
having to say something, but giving that moment for that
mm-hmm,
client to possibly reflect a little bit deeper and
mm-hmm.
give them that space to come back with that feeling. And
Yeah.
that's a great strategy, Miranda. Like I do appreciate the response of trying to tap into the emotions by holding that space for them in
Mm-hmm,
that moment
mm-hmm,
versus
mm-hmm.
simply going to that approach or
Yeah.
take.
Yeah, and I'm glad to hear that that resonates with you. I think, silence as humans, right? It feels very uncomfortable. I think we're taught to fill every kind of space with words and talking, especially with someone you don't know. I mean, you don't know Ramon either yet. You're still a person too, right? And so I think over time, although yes, you're the counselor, you're still part of that relationship. And so I think all of those feelings that you might be needing to also experience, such as getting comfortable as well, working through your own anxieties and self-doubt, being comfortable with silence, those will take time too. But there's no rush to fix it. And I think silence can be powerful. And sometimes, I sit with my clients just in silence and while they maybe cry or they maybe think, and we just sit there together. But yeah, it's a very uncomfortable experience, and I still sometimes get uncomfortable as well.
Thank you for sharing your own experiences of that. That also kind of normalizes how I feel and like knowing that it could be very uncomfortable, but yet it could be very powerful as well, I think is a huge one. And I also wanted to ask you,
Hmm.
you know, when he was talking about the bullying and things, like sometimes it feels like,
Hmm.
okay,
Hmm.
what is kind of the
Hmm.
self-disclosure, right? Like having to
Hmm.
share
Hmm.
story, like would that make it
Hmm.
powerful in the moment or is that going to change? I know there's like we know we and obviously we've studied this, like
Hmm.
its self-disclosure is quite well, but what does that mean and when is the right time? And where
Yeah.
could I have brought that maybe through here?
Yeah, so I just want to make sure that I'm understanding your question properly. So, what I'm hearing is you're asking me when the best time to maybe self-disclose a relatable experience that you had to the client to maybe normalize what they've gone through. So, if he's experiencing bullying, it's like, yeah, I really know what that feels like. I've gone through that too. So, is that what you're asking?
Yes, exactly. Like trying to share
Okay,
kind of
yeah,
sharing the
yeah,
struggle so that it further gives them that opportunity to be more open
yeah,
and
yeah.
vulnerable in these discussions.
Absolutely. So, what you're thinking about in the therapeutic terms is the safe and effective use of self. So, it can be used, and to your point, when is the right time? So, I think based on the relationship, based on the client's trust, based on your observations, I think it's really trusting your judgment and knowing when the right time is. So, Sometimes you'll be able to tell if a client needs to hear that right away in the first session, or maybe you wait a little bit. I think it's really about listening to what feels right for the client based on what you know. And I know as a new counselor, it might be hard to really determine that. So, one thing I would recommend is if you feel unsure, maybe just wait a little bit until you do feel that certainty. I know for myself personally, I didn't start self-disclosing until about maybe 2 years into the practice. So
Hmm.
that might look a lot different for you. And self-disclosure too, it was always very brief and to the point, and always with helping keeping the client's interests at heart. So in Ramon's case, I think it might be best to really focus on just continuing to create that relationship, continuing to create that safety, and maybe a few sessions in, kind of seeing where he's at, then maybe continuing to or opening up a little bit about your experience if the time seems right. Does that help you understand a bit more?
Yeah, definitely. That makes sense because I know it's important that like
Mm-hmm.
come at more of a benefit for the client, not
Mm-hmm. Mm-hmm.
taking it away from them. So, and also
Mm-hmm.
mentioning if maybe that
Mm-hmm.
isn't relevant so much right now because I did
Yeah,
break through and he
exactly.
was able to open up anyway. So maybe I was just
Mm-hmm.
curious how, if that
Mm-hmm.
something is that something that I could bring in
Mm-hmm.
it too. But that's thank
Mm-hmm.
you for sharing that.
Yeah, sometimes clients might feel more inclined to open up if you do share a personal experience right away. But that's why I say try to trust your best judgment, see how the client's showing up, and really try to see what they need. Sometimes it can be a little bit challenging to really determine when's the best time. But I think trusting that as long as you have the client's best interest in mind, that it will be okay.
Okay, no, that's great. Thank you so much. Appreciate that.
Yeah. So I wanted to also focus a bit more on this will be the last point, maintaining balance. So encouragement is great, but when it's overused, it can unintentionally bypass the client's deeper emotions. For example, when Ramon expressed the fear of failure, a balanced response would be acknowledging his feelings. It sounds like this fear is really strong for you. Validate, but then kind of what we were saying before, don't rush to fix it. So that's completely understandable. Let's just sit with that for a minute. What do you feel? How does this feel in your body? Maybe
Mhm.
walk me through what you're experiencing. Where do you feel it in your body? This way you create a space for his emotional processing, while still being supportive.
That's really interesting. No, that's a great suggestion, Miranda. So I do appreciate that too. I think that's a great way to again get back into kind of giving and holding that space for the client to kind of process as opposed to I think
Hmm.
that encouragement should come with the balance. You're absolutely right. I don't think that's a
Hmm.
constant. If we constantly keep encouraging, we're never
Hmm.
getting to the root of the issue or identify the
Hmm.
knowledge.
Hmm.
I think you saying that openly
Hmm.
today gives me much more awareness of that as well.
I'm really glad to hear that this resonates for you. And I just wanted to say again, great job. There's a lot of wonderful work that you're doing with Ramon. I just want you to continue to really trust your judgment. I think when we start to second guess ourselves, that's when, we have to catch ourselves because usually our initial intuitive judgment is it's usually on point. So over time, I'm sure, if we keep working through this, you'll be able to feel a lot more strongly towards yourself judge or your judgments and assessments in the situations.
Yeah, absolutely. Absolutely. I love that. Appreciate it.
Okay.
And
Okay. Are you okay to maybe for the last bit of our time here today, for around 15 minutes or so, to maybe practice a little bit of role playing together?
yeah, let's do that.
Okay. So, let's practice this. I'll play Ramon. And I want you to try responding in a way that both encourages him and creates space for exploration. Is that okay?
Yeah, absolutely.
Okay, so here's a scenario. Ramon says, I don't think I'm good enough for grad school. Hmm.
Okay, let's
How would
hold on to
you?
that
Yeah.
for a minute.
Mm-hmm.
Emotions
Mm-hmm.
are coming up here.
Mm-hmm. Feeling like a failure. Not not good enough.
Okay, and I can hear those are a lot of labeling, so negative labels you're
Mm-hmm.
portraying of yourself. Now, when you're saying that, what emotions
Mm-hmm.
are starting to come through? I want you to really focus in and hone in
Mm-hmm.
to your internal self for a second. Recognize the changes within your body and identify
Mm-hmm.
some of those feelings that are coming up.
Mm-hmm. Okay, so we're going to pause here. So I wanted to say that's great. Wonderful job, very responsive. You're reflecting back to him what he's feeling. You're noticing the negative labeling. One thing I wanted to maybe refine a little bit is slowing down. Instead of having to go into kind of let's fix this and identify this right away, I want us to maybe focus a bit more on the emotional piece. So Ramon says, an example I'll give you is he says, I don't think I'm good enough for grad school. I think I'm failing. And I would say to him, I notice how tough and how painful that must be for you. This is what, I'm seeing. And then, he can confirm or deny. Maybe, Ramon says, yeah, I'm feeling really sad or I'm feeling really fearful. And I tell him to maybe just tell me more about that feeling. And so just kind of want to pause there with him and just really holding that. It's like, yeah, I understand that. I understand how hard this must be for you. And I understand how much fear there can be. And so just trying to really connect with the client's emotional response, but just taking some time to pause. And, Ramon, they're like, yeah, it's just really tough. I'm really scared. I'm like, yeah, well, you're scared, huh? It's very understandable. And just kind of being in that. No rush. And so, did you notice how I let the silence kind of sit for a second? Not really going into intervention, just observing what he's feeling, getting him to name it to me, validating, like, yeah, it must be terrifying. Um, that pause can be powerful. It signals to the client that it's okay, as we said, to feel the discomfort. And it lets him even think, right? I'm feeling fearful. Yeah. Oh, okay. What's going on here? So do you want to give it a try this time and focus on slowing down and allowing space before responding?
Yeah, sure. I think that's a great point. I do see myself jumping to again quickly identify the problem versus giving him that space to reflect on his own emotions. That silence is something I gotta
Hmm.
practice. Not so easy to
Uh,
immediately do. But yeah, let's try that again.
yeah. Okay. Amazing. Silence is, like we said, it's a little uncomfortable. But okay. So yeah, I'm feeling really down about applying for grad school. I feel like a failure. I don't think I'm good enough.
That sounds really tough.
Yeah.
That's that sounds like you're really in a very hard space right now.
Yeah, I'm feeling pretty defeated.
Tell me more.
Yeah, just feels like I'm not ever gonna be good enough. I'm always gonna feel like I'm failing in some way.
How does that make you feel?
I feel really sad. Much better. That felt more natural. And you gave him room to process. How do you feel? How was that for you?
That was good. That was good. I think kind of
Hmm.
putting it, this role playing does help a little bit because
Hmm.
actually implementing it. So it's not like, when you have the knowledge, like what's good
Hmm.
or
Hmm.
what's good for the client. It's almost like there's a difference between how we like know and retain
hmm
that information, and how do we actually implement it with our
hmm
clients? So I
hmm
think coping really does help to really kind of it's
hmm
almost put me in the spot for a moment, but it did feel good to uh, try it for sure. So like it gives me more of a way to kind of bring it in more naturally versus feeling like, okay, when do I give that silence? I
hmm
think it just comes
hmm
in much more naturally.
Yeah, I think that sense of urgency, it's so human. And so I really hope that we can spend some time as we continue our work together to become comfortable with the silence and pause and take some time to really let the client just see, right, what they're feeling and be with that for a little bit. I think it teaches them how to feel more comfortable there and it helps you as well. So again, great work. It sounds like, you're feeling a bit more confidence, but I'm curious. I want to take this next bit of our time together to really just reflect on everything that we've discussed today from the beginning of our time to the end of our time. And just want to see, how are you feeling? We still do have about 20 minutes left. So we'll use this for observations. I'll give you some reflections as well, and we'll go from there. Is that okay?
Yeah, absolutely. So did you want to know about my feedback about how I find
Hmm.
sessions, or did
Yeah. Yeah, I would like to check in and see. So after we've chatted today, how are you feeling? Do you have any questions for me that you'd like to go over?
yeah, so first and foremost, I'm feeling much more confident. Like I
Hmm
feel a little
hmm
bit
hmm
active, and I got
hmm
to
hmm
identify some great ways that I can go
hmm
with this client.
hmm
Excuse me.
hmm
But but I really know now I have better strategies in place. Like I
hmm
feel like talking it through with you has given me much more of a reflective meaning.
hmm
And it's giving me an opportunity to
hmm
uh,
hmm
see a different side,
hmm
a different perception to how I perceived I
hmm
was kind of engaging with the
hmm
session. You see it in what you might, what and how you thought it
hmm
would work differently if I just incorporated potentially those different like powerful techniques like silence or
hmm
creating an
hmm
integrative approach, or holding that space, not focusing too much on finding a solution or trying to
hmm
help them come to
hmm
result, but versus kind of just
hmm
knowing that I'm doing a lot, just being there,
Yes.
individual, and that vulnerability. I think
Yeah.
that gives me better awareness to even understand how the relationship has held
Mm-hmm.
strong all this time. I think, knowing that I
hmm
am being there is quite a
hmm
positive, and enough of a positive
hmm
response. But obviously we're here, but like I feel like I could see how that's a big
hmm
one, big factor.
Yeah, and that's one thing I want to continue to add on too. You just being there, holding the space for him, that is so much in itself. 70% of the therapeutic magic comes from, or 70% of the relationship or the magic comes from that relationship, essentially. So that's where all the magical work is done. The remaining 30% comes from, the technique. At least that's what my supervisor told me once. So you're already 70%, of the way there. I think that's really powerful. And Ramon's really lucky to have you as his therapist. Can see how much time you put into thinking about him. You really care. I see that you really want to help him. And I think your empathy and just being there in itself, and you and your skills and your intuitive ability to really just be with him and observe a lot of these feelings that he's having along with those beliefs is going to be very transformative. So I think it's important to really keep encouraging him, keep using that definitely in session, continuing to work on sitting with the client discomfort So a lot of the slowing down, reflecting, and continuing to explore. Another thing to be mindful of, just to recap everything too, is allowing space for the processing before reassuring. One thing I want you to remember, and I touched on this very briefly, is that you are not there to fix his problems. You're there to be a guide and you're there to help support him. And I think once we can kind of really connect with that and we have those boundaries even for ourselves, it really lets us show up as authentically as possible. But just knowing that fixing the problem comes from a place of love and support, and that in itself will really help continue to build your therapeutic relationship. And so I guess the one thing I also want to continue to go into is reflecting on at level one today, right? Your primary focus has been on building skills, reducing anxiety, and increasing structure in your sessions. I can see that you're working so hard to apply techniques, and I really want to acknowledge your efforts and report and building the rapport, using micro skills, and maintaining engagement with your client. Those are essential foundational elements, and I can really see that you're putting in the work. So before we continue to unpack a little bit more with the remainder of our time today, just want to see if you have any thoughts there.
No, that's amazing. Again, thank you, Miranda. That's really helpful for me. And even
Yeah,
identifying certain things
yeah,
I didn't, really catch or see.
yeah.
That's why it's so helpful to come to these sessions because I do get a
Mm,
different
mhm,
lens on things.
mhm.
Um, it stops me for a moment to kind of recognize that because I didn't even know
Yeah.
like what
Yeah.
I'm doing until I
Yeah.
brought that through and kind of,
Mhm.
had watched my video. So like kind of
Mhm.
seeing how I was engaging with a client and possibly wouldn't give him that space.
Mhm.
Again, it's been quite
Mhm.
significant for me to recognize.
Yeah. Yeah, thank you for that. I wanted to say, I hear, right, there's a high motivation, um, but there's a bit of that, there's lower autonomy. So I see that you have that strong desire, right, to just get it right. Um, and while you're still relying on external structure and feedback. So I see that in your approach. You're eager to apply what you've learned. You want to learn, you want to understand, and that's a strength. And so one thing, though, I really want you to focus on is to push yourself to start trusting yourself a bit more in the process. Kind of going back to when you asked me today about when is the right time for self-disclosure. And so I think, it's hard because there's no formality about like when is the exact right time. But I think really trusting yourself, your client, and knowing what feels right is an example of trusting yourself in the process. So I noticed, right, there were a few hesitations even before reinforcing Ramon's shift in confidence. It's almost like you were looking for some external validation before validating his progress. So I want you to just, in moments like that, trust your intuition, trust yourself and your clinical instincts. You had the read on the moment. You have always have like the right response immediately, but then you second guess yourself, and I saw like a pull back. So one way that we can continue to build your autonomy, which I want you to work on as your homework, is through maybe some self-reflective questioning. And instead of asking, did I do this right? Maybe you could ask yourself, what impact did my intervention have on the client in that moment? So I think this shift here is to focus from technique driven to impact driven. So I just really want you to focus on building that trust within yourself a little bit more. I'm curious, what are your thoughts around that self-trust? It's hard. I'm still working on mine as well. So it's a process.
Thanks for sharing that
Hmm.
kind of again, further is normalizing. Um,
Yeah.
to hear Miranda and to know that, it is a process.
Hmm.
I think that's a good point. I think I am maybe
Yeah.
like or maybe overanalyzing or, kind of overthinking certain things as when I can just really trust myself to just engage. Like sometimes I do kind of stop
Hmm.
help sometimes from giving that space. I think in that mind was always kind of running to how do I see the
Yeah.
results? Like, how do I help this
Ah,
person get to where
yes.
to be quickly versus like
Yeah. Yeah.
present, like here.
Yeah, I'm really glad that you brought that up before the end of our session today. We still do have some time. But I wanted to say it's very common for early counselors to want certainty. So I think that certainty is we want to know the answers, right? We want to give the client the answers. We want to figure things out really quickly, right? I think even sometimes we can fall into their sense of urgency as well and feel the pressure. So, one thing I wanted to say is you may want to know exactly what you have to say. You may want to have a clear roadmap as well. But I think a lot of the times in therapy, it's pretty ambiguous. There'll be moments where I want you to know that you might not always have the answer, and you might not always know the exact direction of where the session is going, but that's okay. And so I think one area for continued development is learning not only to sit in silence, but to also embrace that uncertainty. And I think that goes back to what we discussed in the session today. Whenever Ramon paused or seemed unsure, it's like we have to fill the space quickly. So I think one thing to really remember, which I know I've said in a bunch of different ways, but silence is where the real work happens, and being okay too with that uncertainty. It really helps even you show up and be a bit more present too for the client, because you're not so focused on, I have to know all of the answers, I have to fix this, I have to resolve this. So when you embrace them, it even allows the client too, right? Not to have that expectation to, for you to have all the answers. So it allows them to, as you briefly mentioned earlier, work it out on their own. But while you're guiding them. So all they really need is you to be present and show up, and of course have that plan in place. And sometimes plans don't always go the way that we plan. So I think that's something to also work on outside of here as well.
No, that's amazing. That's my biggest takeaway, I think, from the session is knowing how to just
Hmm.
implement that silence, trust
Hmm.
self, being able to remember that being there is the biggest and supporting, and being able to kind of open my mind to different perspectives or techniques as well. But the biggest one is, of course, silence. Absolutely.
Yeah, so for the last 5 minutes here, I just want to sum this up. So you are showing very strong motivation, great rapport building skills, and an ability to structure sessions effectively. And because of that, Ramon has already trusted you so quickly within the first session. We can already see there's that layer of trust that's unfolding, and we can see that consistently, throughout. So I think it's really important to continue to focus on deepening client attunement, not just focusing on the intervention, but the client's moment-to-moment experience. I want you to focus a bit more on, as we mentioned, trusting yourself. So shifting from, am I doing this right, to how is the client responding? Also allowing for more flexibility, so balancing structured interventions with in the moment emotional processing, and allowing the natural flow of therapy. Sometimes, we have this, we're going one way down the road, and then all of a sudden something comes up, and then we make a U-turn and we go back. And so there will be unexpected moments. And I think the more that you can prepare yourself and become comfortable with that piece, it will help support you and show up more authentically as well. And I guess that leads me to our next session. I want you to maybe reflect a bit more on moments where you felt unsure in your next client session. Jot down these moments and let's discuss them. I also want you to intentionally allow for 3 moments of silence in your next session and observe to see what happens. I want you to pay attention to what are you feeling, right? What are you feeling internally as you're in there in the silence with Ramon? And I want you to see, right, how is the client responding as well? The more that we do this, the more that we see, oh, it's okay. I don't have to jump to the clients, and I don't have to respond immediately. I want you to just practice holding space. I also want you to bring in a moment from your last session where you felt you had a genuine shift, where something clicked, as we discussed earlier at the beginning of our supervision session today, when you were really able to help him shift his beliefs or view things differently and make the connections from childhood. So when there was that aha moment, I want you to kind of think of another aha moment or where you felt confident in your clinical choice. I think we'll use that to really build that trust within yourself and reinforce what's working well. I guess the last thing I'll say really is I see strong growth a potential in you. You're at a point where you're building confidence, and I'm here to really support you in your skill development while you're also still challenging yourself. And I want to help you challenge to take more authority over your therapeutic decisions. And I really want to help continue to support you to build that self-trust. And I can see your desire to help. It's so strong. I can see you have such a strong compassion for your client and so much care. And that in itself is going to be your biggest resource as a counselor. And Ramon's really, really lucky to have you supporting him.
Oh, that's amazing. No, thank you for that feedback, Miranda. Those are great points. And again, I really appreciate those kind words. It does help me to,
Hmm.
strong within myself as well and the work I do, but also kind of hone in on what I can improve or incorporate with my future clients. And I will definitely do that for next session where I will kind of really focus on giving that, like providing or implementing that silence, how it makes me feel, kind of figuring out, like, pinpointing those aha moments and bringing that to you. So you're also going to be able to kind of guide me through. And I will definitely take notes of that and bring it through into our future sessions, especially with Ramon, as well.
Yeah, I really look forward to seeing the work that you continue to do with Ramon. I have no doubt that it will be not amazing. It will be fantastic. So we'll continue to support you. And if you ever need anything, you can reach out to me. But yes, I have no doubt that you'll do very amazing things in your work with him and with every other client you're supporting at this time.
That's amazing. No, thank you so much, Miranda. I do greatly appreciate this time. And I'm glad that we are meeting on a weekly basis, so I can get a little bit more kind of focus in on how it's developing and what it's like moving forward with these sessions and especially with Ramon. So this is going to be really good. And today's session was extremely helpful. I gained a lot of insight today.
I'm really glad to hear that. And like I said, if you need anything, please always reach out to me, okay?
Definitely so. So so yes, and then is there I think we already booked our next appointment as well.
Yeah, I have you booked in for next. Let me just double check my calendar here. Valentine's Day, next Friday the 14th at 2 p.m.
That's great. Yes, I did book it at that time and hopefully, I do and I am going out that day later, so it'll be
Okay.
good for my self-care.
Okay. Well, I'll see you next week, okay?
Thank you so much. Have a good week.
Thank you. Take care. Bye.
Bye.